With the world still grappling with COVID-19, the gold standard in testing remains a PCR test. Swabs are used, which are then tested in a lab by trained technicians. The result will tell you if you have the virus, but tests typically cost over 1,000 Rand each, and it can take days to get the results out of an overstressed system. Rapid diagnostic serology tests, which test for exposure to the virus, is another possibility. They quickly provide crucial information for managing this pandemic. But, like PCR tests, are globally in short supply.
When we first heard about the outbreak in China, we moved very quickly. We got the gene sequence because it was made publicly available, and we've synthesized that gene, we've put it into our plants, and we've created the antigen for COVID-19.
This is where a remarkable South African company is at the forefront of innovative ideas to provide a solution that is, quite literally, homegrown. Meet biopharmaceutical entrepreneur Belinda Shaw. Belinda is a multi-award-winning veteran 50/50 producer and presenter and was elected South African Environmental Journalist of the Year in 1991. She has contributed a range of stories to 50/50 from the age of 28, also originally appearing in front of the camera. Belinda's nose for a story and her sheer tenacity showed that she was never afraid of looking for the great stories out there and bringing them to 50/50 viewers, no matter what it took.
All right, give her a little slack, give her a little slack.
Where is it?
Hang on, give her some slack, give her some slack.
It was Belinda's search for another 50/50 story that would set her life on a completely new track.
In 2014, my son said, "You've got to come to a TEDx talk in Cape Town." So off we went, and there was Professor Ed Rabisky from the Biopharming Research Unit on stage talking about making vaccines in tobacco.
What if there were a way to make complex pharmaceuticals inexpensive? And what if we could do it right here in Cape Town? Can we do this differently? Yes, we most certainly can. Like that. That is the new factory.
This, to me, was mind-blowing. I was completely blown away. The audience gave him such a round of applause. So from that TED talk, I then started investigating it.
This research led her to UCT's Biofarming Research Unit.
When Belinda approached us for an interview for 50/50, we were very flattered. It was quite prestigious, we liked the program, and it was a good avenue to put our stuff out there. Plants are full of proteins. I mean, these leaves, the most abundant protein on Earth is a thing called ribulose biphosphate carboxylase, because that's what actually enables photosynthesis. The plants are actually pretty good at making protein. All we're asking them to do is make a foreign protein.
Belinda was astounded to discover that the basic science Ed was talking about had been around for about 20 years. Yet, since funding was scarce, no one in South Africa was showing a significant interest in commercially licensing these ideas.
I looked at my daughter, who's master's in medical biochemistry, and I thought, we have to do this. It was like an aha moment.
After that, 50/50, Belinda actually was one of the people that was most interested. We thought, well, nobody else is doing anything. The idea was, she's a crazy journalist, but go for it. And it has been incredibly impressive to see what happened when she went for it.
Proteins are traditionally grown in mammalian cell cultures or in bacteria in eggs or yeast. This typically involves the use of huge stainless steel bioreactors.
These systems will cost you about $150 to $500 million to build and take 4 to 5 years, which is why Africa doesn't have one. Compared to a plant-based system, we can build one of these at a tenth of the cost in 6 months, which is exactly what we did.
In 2017, Cape Biopharm started out on a small scale by establishing a lab in Cape Town. Belinda rolled up her sleeves and set about growing the business.
In the early days, it really was fun because I got involved in the seeding, and these seeds are almost smaller than a grain of pepper. This tiny little seed becomes a plant as big as this. And I mean, this is about 4 weeks old.
They use the plant Nicotiana benthamiana, a weedy relative of the tobacco plant. This is ideal as it has virtually no natural defenses against infection and is quick to grow.
The real disruption around the plant-based expression platform is we can make proteins faster and cheaper.
Belinda enlisted her daughter, Belinda Shaw, who holds a master's degree in medical biochemistry from UCT, and her expertise together with that of some key senior graduates from the Biopharming Research Unit. This team set about the business of growing medical-grade proteins in plants.
Basically what we do is we take the gene sequence for whatever protein we want to make. The DNA is transferred into bacteria, and then at about 5 weeks old we dunk the plants into this bacterial solution. We create a vacuum, and when the vacuum is released, the bacteria rush into the plant cells. So in this way the plants become like little mini bioreactors, and they actually produce the protein for us. So whatever gene we've inserted into them, they will produce the corresponding protein. And thereafter we harvest the leaves, we make a smoothie, and we purify out our target protein.
This plant-based extraction platform is extremely flexible, as well as being ecologically friendly and ethical.
We don't experiment on animals in this lab. We don't have any animals in cages. I think making proteins in plants is a far more ethical alternative.
Companies started queuing up and ordering proteins for a variety of purposes, including custom research products.
In early January 2020, we had a pipeline of over 20 different products that we had created. Among these was an anti-HIV antibody that we had begun to sell, as well as some novel fusion proteins.
And then the world changed. On 11th March 2020, the COVID-19 epidemic in China was declared a worldwide pandemic. Antigens are used for testing for diseases. Senior scientist Francisco Pera was given the task of cloning the gene sequence for the SARS-CoV-2 antigen.
I'm in charge of what's called molecular cloning, which is basically putting different pieces of DNA together so that we can have the final gene expressed in plants. So working on COVID is actually a cherry on the cake because I already loved what I do. And now the applications of the work that we are doing, it does put a little bit of pressure, but it just builds up to the excitement, I guess.
The team infiltrated plants with a vector containing Francisco's gene sequence. These plants were then left to grow, and the first of their COVID-19 antigens grew inside the plants. A mere 3 days later, leaves were ready to be harvested.
My job is to extract out that specific protein that we've told that plant to make, in and amongst all these other plant proteins in there. And it is quite challenging. After that process, we've gone all the way down to the target protein, our protein, in a nice, pure, concentrated format, and that's what we can send to the test kit manufacturers.
The World Health Organization has this kind of refrain, test, test and test again. What our antigen can do on a test kit is to be able to pick up as you've been exposed to the virus. At the moment it can't pick up that you have the virus, but it shows you've been exposed to it. And this can give you a result within 5-6 minutes, pretty much like a pregnancy test.
This kind of test can be done in the field using a drop of blood from a finger prick.
What's really exciting is Test Kit 2.0. We now have the antibody in R&D. So once this goes onto a test kit, it will pick up the early stage of infection, and it'll be able to tell you if you have the virus in your system.
For now, though, serology tests using their antigen are center stage. Ashley Ace heads up one of 3 different Cape Town-based rapid test kit manufacturers that are developing test kits with the Cape Biopharm's antigen.
Regulations to develop diagnostic products are really strict, and I believe it should be this way. You cannot put a bad product out in the market. In order to develop a quality product and a well-validated product, our regulatory authorities, SAPRA, they put out a specification for us to achieve. We validated our initial prototype developed using Cape Biopharm's antigen at IDM, at UCT, and the initial results we got met the specification as required by SAPRA, but based on the sample size they had at UCT.
These test kits are now awaiting validation by South Africa's overstretched validation authority. but Ashley has confidence in their quality. An estimated 10 to 80 million kits will be needed in Africa over the next 6 months. According to the Africa Centre for Disease Control, however, African countries are struggling to purchase tests, even when there is plenty of funding available, simply because Africa is at the end of the international queue.
In order to fight an epidemic and pandemic effectively, you need data. And in order to get data, you need testing.
Just what kind of potential numbers are we talking about?
Our production capacity is 50 to 80,000 tests a day. 50,000 times 20 days, million a month.
It's absolutely critical that we have security of supply for Africa. And that has been the essence of why we started all of this. And a plant-based system is the way to do it because it's quick, it's cheap, it's effective.
The work of the company has caught the eye of serious funders, and significant scale-up is being planned. Additional resources are roped in for large-scale seeding and growing, and the use of multi-level grow rooms are being investigated.
There is life after COVID. For us, going forward, it's building the capability to be able to produce so many more proteins for other diseases. HIV, TB, malaria, critical diseases that affect Africa.
The future of medicine is not synthetic drugs anymore. It's now proteins that have been made in living plant organisms.
It's been a particularly satisfying thing for Ed Rybisky to watch.
To be able to see what we started actually come to fruition, and at this time of the pandemic, when Biopharms were exactly in the right place at the right time to actually make things that are of use, it's truly wonderful.
And for the environmental journalist turned bio-entrepreneur,
to get where we are now has been the most incredible journey. And the team that we have, and suddenly being launched into the global stage, is just, I have to pinch myself. I'm so proud of the team, and I'm so incredibly proud of what we've been able to do. And we've only just started. So watch the space.